I wanted to bring today's episode to the podcast talking all about the postpartum period. Many people on the fertility journey are in a rush to have their child. They want to have their child yesterday, which is completely normal. The thing is, when we rush towards this and not focus on our preconception health, how does that impact the health of our child and also the health of our postpartum period? And so today we're talking about things you can do right now to improve the chances of a healthy postpartum period. And really you're in a very empowering position to make those changes from a physiological standpoint and also from a mental, emotional side of things. Excited for you to listen to today's episode. Let's go. Hey, Dr. Labib, excited to have you on the podcast.
Me too. I'm very excited to be with you today, and I'm ready for all the topics we're going to cover.
Yeah, exactly. So let's really. First of all, let's kind of just, if you can share your journey of how you came to do this work.
Yeah. So basically, this book was inspired by a personal story. Actually, my wife's story. After giving birth, she had some issues recovering fast. And at that time, I was practicing, completely pure conventional medicine. And a lot of her symptoms, I used to blow them off. Like, oh, you'll be fine. This is normal. And then after a while, I started asking myself, like, why is she having those symptoms? And I looked back at all the years I've been practicing, and I always did not pay much attention to postpartum patients. I mean, we would see them at 6 weeks, do the checkup, discuss contraception, check, everything, the incision, blah, blah, and then that's it. See them back in a year or, on their next pregnancy. So I confess I was a bit, guilty and did not take care of patients postpartum. And I noticed with time, that really, like, this is something that we need to talk about more, spend more time with our patients postpartum, because it's a very important phase. It can dictate a lot in their life and even in their general health for the years coming. So that's how the idea came. And at the same time, actually, I met a doctor. She's actually a physical therapist. She's originally Lebanese. I met her here in Miami, and she was helping us with potty training and for my kid. And she is also a specialist in physical therapy and rehab and pelvic rehab. So she was very interested in helping women recover faster. She has different techniques than I'm used to. I mean, we're in med school and residency, we learn Kegel exercises and that's it. So she taught me a lot about those things. So I asked her to contribute a chapter in the book, and that's what she did, and I learned a lot from it. And so yeah, that's how the whole idea of postpartum came. And now I pay more attention to my postpartum patients, and hopefully we can talk about this openly, normalize the postpartum or the fourth trimester.
Yeah, and I wanted to bring it to the podcast today because I wanted to talk about the importance of why we want to take some. Because a lot of times we're getting married. It's interesting. I interviewed Dr. Ben Lynch like years ago, and he said, "Why don't we spend we spend 12 months to 18 months preparing for our wedding? Why don't we switch that around and spend the same amount of time for our baby?" So here we are.
Yeah.
In the preconception period, in a very powerful position to really then impact the health of our child, our postpartum
Absolutely.
period. All of this matters. And a lot of times people on the fertility journey, we're in this panic. We're told that we're too old, our eggs are too old. We got to rush. And, we just want to get pregnant yesterday. But this is like a crucial period. And forget about, obviously, you want to have your child healthy, but then sometimes we forget about ourselves. And then that postpartum period where we have symptoms, they're brushed under the carpet, and sometimes people are suffering, like women are suffering for months, and then finally getting diagnosed. So we'll get into some of the postpartum period, but I wanted to kind of talk about really why is this preconception period so important to take time to work on your health.
Yeah, I think the preconception period is as important, if not more, than the pregnancy itself and the postpartum. So whatever you see postpartum can be consequences of what happened preconceptually or during the pregnancy. So, of course, it's important to try to help and get to the root cause of issues postpartum, but sometimes it's so difficult if we're far along in the problem. So, if we start before, optimize our health before getting pregnant, then the pregnancy will be smoother, the postpartum recovery, the delivery itself will be smoother. So the preconception is actually where we need to catch people. Unfortunately, most or maybe half or even more of the pregnancies are unintended and or unplanned. So it's sometimes difficult to optimize before pregnancy. But if somebody has a medical problem, diabetes, hypertension, lupus, cardiac disease, you have to optimize their health before getting pregnant, because we know all these diseases, if you are not in remission or you were in an active phase of, let's say, lupus, and you get pregnant, the pregnancy will be complicated with preeclampsia, preterm labor, fetal growth restriction. So we have to optimize the health before, and that's exactly what you guys are doing at Fab Fertile, helping optimize their health, which will translate to optimizing their ovarian reserve and for them to get pregnant. But at the same time, I think you're optimizing their health so that their pregnancy will be better, and then eventually the postpartum. I think preconception, we talk about it, and we do help women in that phase, but the postpartum is where we physicians and other healthcare providers, we neglect them. And even like the people around these patients also a lot of times don't support them, and the support is extremely important during that phase. So that's why the book. But like you said, preconception is extremely important.
And then some of the complications that they could experience during pregnancy. So high blood pressure. Can you kind of talk about that? Why it's important? Because a lot of the times people will come to me. I'm dealing with poor egg health. The embryos aren't making it. They've gone through multiple failed IVFs, and then no one's gone and looked at their health. And I shouldn't say you haven't looked at your health. You've probably done some generalized recommendations. Followed an egg health diet and made some changes to cut out coffee, try to reduce your stress, but maybe we're not aware of how our blood chemistry, how different tests, and really, why that matters and for our health and our postpartum. So if you've got high blood pressure, what is it? Why is that important to look at?
Yeah, I mean, like if you think about people that have poor ovarian reserve, let's say early on in their 30s, it means their health is poor. So ovarian reserve does reflect your health in a way. And, we know women with low AMHs, have, struggle to get pregnant. But if they get pregnant, their pregnancy outcome or adverse pregnancy outcomes can be worse. We can get them to get pregnant, like you guys are doing, but then the problems can arise during the pregnancy. And one of the issues is, preeclampsia, which is high blood pressure. Usually we don't see this before 20 weeks, and more commonly 90% or even more happen close to term. But sometimes we see them early on, around 3 to 5% can happen, around 32 weeks, and a little bit less, before 32 weeks. And, preeclampsia is a very serious condition. It can affect maternal health. It can lead to organ damage. It can lead to blindness, stroke, and long-term morbidities and mortality even to women. So preeclampsia is extremely important to try to prevent, and the prevention starts before pregnancy. Yes, we do have some things that we can do. For example, aspirin can be given to certain high-risk women, let's say for twins, or they have previous preeclampsia, or they have other risk factors. But it's not magic. It's not going to completely eliminate preeclampsia. But if we work on their health and decrease inflammation in their body, make sure their gut health is important, their thyroid is functioning well, their vasculature is working well, they don't have hypertension, their kidney function is good, we will decrease the risk of preeclampsia. That's one of the complications. And again, we have also, gestation diabetes, which is another issue that, can arise. And, causes can be numerous. It can be related to their diet, to the hormones of the pregnancy, even to the gut health. Now we're seeing a lot of correlation between gut health and developing gestation diabetes. And of course, gestation diabetes can have sequelae on the mom and on the baby. So these are two examples. Then and another big one is preterm labor.
Yeah, I was going to say that.
Yeah, preterm labor. Again, we don't know why it happens, but definitely there is a state of inflammation that triggers this, fetus to come out. And pregnancy itself is a pro-inflammatory state. So, but sometimes if we are already inflamed getting into the pregnancy, then the preterm labor risk will go up. And so, working on it prior to the pregnancy, making sure that their nutrients are well balanced, all their minerals are balanced, their diet is balanced, they exercise, all this will help decrease some of this inflammation and will decrease the risk of preterm labor. Unfortunately, we haven't been able to decrease the risk of preterm labor over the last 50 years. The good thing we've had is we are able to resuscitate preterm babies better and give them better survival, but we have not decreased the risk of preterm labor. Neither in the US, and actually in the US, it fluctuates, but sometimes some years it goes up, for example. In other countries, it can be lower, it can be higher. In Scandinavian countries, for example, it's a little bit lower than other countries. So it depends where you are geographically. So definitely there is something in our lifestyle that's leading to this, whether it's the food or toxins we are exposed to, stuff that we do in our lifestyle, smoking and, drug use and all these things contribute. So yeah, preterm labor is a big problem. And, the only things that have proven to decrease the risk is optimizing the health before. There are certain medications we use like progesterone, and certain people that have history of preterm labor, but it's not for everybody to use progesterone. And I think the way it works, it relaxes the uterus, the cervix, and it decreases inflammation. So it's one of the ways probably how progesterone works. So yeah, preterm labor, we're still where we are. We haven't improved the numbers yet. We improved, of course, the babies, but that's not enough. That's not enough. We need to decrease the rate of preterm labor.
No, that's interesting. Even it's like the toxins were all 85,000 toxins that we're exposed to, and all those studies they found with the toxins in the cord blood of babies. So
yes. I mean, not only that, actually, they even found like nanoplastics. Now there's a lot of talk about nanoplastics that we found in the bottles, in the plastic bottles, and they found those inside placentas and even inside the baby meconium, which is the baby poop, basically. So it's not only getting to the placenta, it's even getting to the to the babies. And we don't know what are the long-term consequences of those nanoparticles. I mean, of course, the body gets rid of a lot of the things we're exposed to, but at some point, if you damage some of the filtrating organs in your body, like your liver, your lungs, your kidneys, then you might not be able to get rid of these toxins. And maybe this is why we're seeing more chronic diseases and more like autism, for example, in kids, and developmental disorders. So yeah, there's a lot of correlation, but I will not say causation, because maybe in a few years we'll say yes, this is a direct cause, but definitely there's a contribution of the environment plus the genes, like what we call epigenetics, and this is what's showing up as these long-term lifestyle diseases in our kids and adults even. So yeah.
What about is depression and anxiety? We see a lot of people, obviously situational, if you're on the fertility journey, feeling very perhaps anxious or depressed. But also it could be going on with imbalance in the neurotransmitters, years before trying. And then when you're pregnant, these, having mood imbalances. Anything you're seeing there?
Yeah, of course, women or couples that go through infertility treatments or go through a long journey, they'll have more anxiety, and they're more prone for depression. And also people that have depression prior to the pregnancy, they're more prone to develop it postpartum. But if we look at women that never had these issues, and even those women still get postpartum blues, which is a very short time where you feel down, you have no energy, and which is physiological sort of. But if this progresses and stays for months, and then this is going to be pathological. I mean, the exact reason why depression happens, we really don't know, but it's definitely a combination of the stressors that happen during the pregnancy, the inflammation that happens during pregnancy, the drop in the hormones. Of course, maybe toxins do play a role if they mess up your thyroid, because hypothyroidism can present as depression. And you would maybe, unfortunately, start the woman on antidepressants and it's her thyroid not functioning, or her, nutrients are not, balanced. She's not, clearing a lot of these toxins from her body. Even the gut microbiome changes in pregnancy. Not only the gut and the vaginal microbiome changes in pregnancy for a reason. Like, it becomes more pro-inflammatory, to protect the baby in a way, to absorb more nutrients. But sometimes if it overreacts, becomes more inflammatory, it's gonna cause problems during the pregnancy or, postpartum, and could play a role in depression. The gut microbiome or the gut dysbiosis can be a reason, or one of the things that we can work on, to help women postpartum recover faster and get out of depression.
Yeah,
And don't forget, I think the most important thing, sorry to interrupt you, is the support. I think I mean, it's so important, unfortunately not everybody has, a huge family around them to support them, but at least a partner, for him or he or she to support, the person who just had a baby. And this is so important, to be by their side, be positive, because again, men, for example, do go through postpartum depression, and this is not many people talk about it, but having a new responsibility, financial responsibility, they go through this, and this is a real thing. So it's both men and women. So by helping each other, I think both will. The relationship will be stronger. The risk of depression will be less. But of course, the woman, suffered more. She went through the pregnancy, through the delivery, so she definitely needs support, friends, family, support groups, talking to people. I mean, just by talking and asking questions and getting knowledge, you will feel better in a way. On top of what we have physiologically that we can try to fix, either through the conventional medicine, replacing iron, treating the thyroid, but also I discovered with time that functional medicine, or the root cause medicine, I call it, or the why medicine, does help a lot. Combining it with our conventional thoughts, not each one alone. I think by combining them, it's even more powerful.
I agree. Yeah, it's not about, if you need to have medication, it's not about saying we're against medication,
Yeah.
but you need to also, is there, the diet and lifestyle, the supplements, all being able to take a target approach with that. And
Yeah, the medications can be like a stepping stone, to
Mhm.
fix the symptoms, and then in the meantime, we'll be trying to figure out the cause and to get the problem from its roots, basically, and eventually, hopefully, stop the medication and live without it. But sometimes you can, sometimes we don't know, we can't get to the bottom of the problem. It's at the end, some things can be, a combination of things, and you might not be able to fix everything and let the harmony of the body come together. So, but trying is important, and combining them, like you said, is key.
Mhm. And so some signs of postpartum depression here. So we've got feelings of hopelessness or pessimism, feelings of guilt, helplessness, feelings of irritability or restlessness. I know definitely when I had my kids, I wasn't depressed. I was more like ticked off, like I was just
Yeah,
cranky.
yeah,
I
yeah,
remember like
yeah,
having like on the phone, I wanted to whip the phone out of the window, just like really, a lot of irritability, problems with
yeah,
concentration, memory, decision making, loss of energy, issues falling asleep, overeating or loss of appetite, suicidal ideation, aches or pains that do not improve with treatment. And many of these
yes.
things you could just be like, okay, it's, as I say, the baby blues, I'm fine. But then it could go on for a period of time.
Yeah, no, if it goes beyond 2 weeks, you should not ignore it. And I think physicians should not ignore it, or any healthcare provider taking care of the patient should not ignore it. Oh, this is normal, go away. I mean, I told my wife that, just, you'll be fine, be strong, don't worry, this is normal. But now looking back, like, maybe I was too dismissive, and I shouldn't have, because, she went through blues, but then it progressed a little bit more. So yeah, I think even symptoms of abdominal pain, headaches that are not explained by anything can be a sign of depression. It doesn't have to always be suicidal ideations or crying spells all the time. So if you don't ask the patients, if they don't talk about it, also nobody's going to help you if you keep it inside you and suffer on your own. So speaking out and out loud, I think is key.
And so it can last about 3 to 6 months, and then 80% of people go into full recovery if they have the right treatment.
Yes, absolutely. Yeah.
And so let's talk about some of the things to help here. So, well, first of all, let's get into the link between thyroid health. This is what we see with people that are on the fertility journey. Our whole thesis on this is it actually early menopause, or is it actually your adrenals? Adrenals impact the thyroid, then your AMH and your FSH and follicle count. And so for this piece, if you have a mismanaged thyroid, and so many people do, being told your thyroid is normal but isn't optimal, and there, so you got pregnant, and now here you are in the postpartum period, and is there a thyroid issue? So maybe talk about postpartum thyroiditis or the thyroid piece.
I mean, traditionally we used to check TSH, and if you only check TSH, you will miss maybe 10 to 12% of women with hypothyroidism, for example. So we have to really check the whole thyroid panel to be able to make the right diagnosis. Yes, because of the inflammation of pregnancy and the stress of pregnancy, the thing is, like, pregnancy is, like, I call it a stress test. When you run on the treadmill, this see if you have a heart issue. Pregnancy is the same thing. It just stresses the body, and then women will have preeclampsia, let's say, or gestation diabetes, and these women are prone to have this later in their life. So it's kind of like a sign that like, I'm prone to diabetes, let me take care of myself. So, but back to the thyroid, yes, because of the inflammation, a lot of times the thyroid will initially present as hyperthyroidism. Because of the inflammation, you just release all these T3 and T4 and T4, and then which converts to T3, and then they get symptoms of hyperthyroidism, inability to sleep, and of course they wake up every 2 hours to breastfeed, and then plus the hyperthyroidism, the irritability, it's going to make things worse sometimes. And then once the thyroid hormone empties from your thyroid, you're going to go into hypothyroidism, which will present as lethargy and fatigue, swelling, pains, and then even depression. So yeah, it's not only the thyroid that's important. You talked about the adrenals. Adrenals are what release catecholamines, which are important for whenever we're stressed. So the pregnancy is a state of stress, 9 months of stress. So imagine how much these adrenals are going to work. They can fatigue at some point. I mean, if you don't have enough reserve before you're pregnant, they can deplete you from catecholamines. And then when you have, a sick adrenal, you will have also symptoms of fatigue and stuff. And then you need a lot of energy to let a baby grow inside. So if you look at the cellular level, then our cells have mitochondria, which are also like the engine, the tiny engine. So these also can get tired and exhausted. So we have to help replenish those by food initially, and diet, and then maybe sometimes supplements, eliminate the toxins that are poisoning these mitochondria also. So you have to work on all these 3 or 4 systems together in order to improve your symptoms and get to the bottom of it. So yes, thyroid is very important. And not only that, if you are hypothyroid or hyperthyroid, you might not have breast milk, because prolactin and TSH are kind of antagonistic. So if you are hypothyroid, your prolactin might be high but might not be effective, and vice versa. So yes, it can affect your breastfeeding, which can lead to more frustration, less sleep, maybe mastitis at some point because you're trying so hard. So yeah, it becomes like a vicious circle.
Yeah, that was me. They weren't. So I was diagnosed with POI at 28, and then went on to have both my kids with donor eggs. And then when I was breastfeeding my daughter, well, first of all, I felt like I was like pumping for like 45, pumping and pumping. I'm like, oh my God, I got to go out. Like, this is crazy. I'm pumping.
It becomes frustrating.
Yeah, frustrating. And she would like eat for like 40. She still eats a lot now. She's a little eater, but just always like, I'm hungry. But I wasn't getting enough supply. And looking back, I probably had a thyroid issue. Obviously, there could be dehydration or like your electrolytes and things like that. But I think so many people with the low milk supply, it's an undiagnosed thyroid disorder, perhaps.
Yeah, if you talk to lactation specialists, they tell you, you know, this low milk supply does not exist. Everybody has, milk. It's just, how you're doing it, and, to make sure, things are, your thyroid is functioning well, you have enough energy to produce milk. Of course, like you said, it could be dehydration, it could be, lack of sleep, it could be your thyroid, it could be even the techniques of breastfeeding. It's so important, learning how to breastfeed and using the right techniques. So that's why I think women should talk about it, ask before starting. I mean, it's not something you're born with, and I think a lot of people expect women to be perfect after delivery. You have to be a perfect mom, breastfeed and work and do everything at the same time. No, I mean. It's not reasonable and it's not logical to expect perfection from somebody who just had a baby. Add to this if she had a preterm delivery and a C-section and she had preeclampsia, so it's too much for the body to handle. But yeah, lactation specialists, I think, are extremely important. I have a small chapter about breastfeeding, but really breastfeeding needs a whole book. Uh, but yeah, like the whole message is to let women, try to talk to lactation specialists out there, someone, or maybe their physician. Some of the physicians are really knowledgeable about breastfeeding and, have certifications in breastfeeding. So it's not only lactation specialists, but it could be a doula, it could be a lactation specialist, a nurse that has extra training. Sometimes friends can help. So yeah, ask. If you don't ask, you're gonna suffer alone.
Yeah, because it could be a functional reasons. Maybe there's infant tongue ties or poor latch or suck, or
Yes,
some of
of
those
course.
things. But
Yeah,
like, I think some of those things you can work with the lactation consultant. But I think obviously
absolutely.
working on your health is to getting the root as to why it's low to begin with. Because we work
Absolutely.
with a lot of people that are dealing with secondary fertility issues, and maybe they had their child with no problem, but maybe they had poor milk supply. Now they're trying for their second, and all of a sudden out of the blue, low AMH, high FSH, POI, DOR, but there's can be reasons underneath that as to why
Yes,
that's happening. And
absolutely.
then, yeah, just back to the postpartum. So you did mention before if there's a family history of depression, then that you may be at a higher risk then of developing the postpartum depression side of things.
Yes, yes, yes. Yeah, a
Mhm.
lot of times, these women, uh, their moms or their sisters had it. So there's something also maybe in the social circle of it, but also definitely something physiological. So yeah, history of postpartum depression. Actually, women that have hyperemesis, that have a lot of vomiting early in the pregnancy,
Oh, yeah.
are more prone for depression also. So yeah, I mean, there are multiple risk factors for it. But at the end, I think we just have to try to find, several causes, not just one cause, and work on all of these together. Yes. I mean, in med school, we learned that everything that happens, there's one cause for it or like one thing. So I think like looking at the whole body and diversifying our brains and opening our minds, will help us work on different issues.
Agree. And so some of the testing that we can look at if for postpartum hormone testing, adrenals, micronutrient. Can you talk a little bit about some of those?
Yeah, yeah. I mean, one of the things that I still don't think there's a lot of solid data on is, the drop in progesterone. And, some practitioners do supplement progesterone for postpartum depression. I mean, there is some data, but it's still conflicting. So before we have solid data, I don't, use it or recommend it at this point. But of course, if I don't find anything else, I might do that. So progesterone supplementation is one of the things. So checking your hormones can help us know where the levels are. Of course, the thyroid is important to check, especially if she had a thyroid issue during the pregnancy or before the pregnancy, or if she's having symptoms. Iron levels are very important. Uh, Also, if you are anemic, have this fatigue and you don't feel well, you don't heal well. So you have to really optimize your iron. But also, we have to be careful with iron. People, I think, overdo it with iron, and this can be, dangerous too. So we have to be careful. Vitamin D is a big one too. Vitamin D is a substrate for a lot of, our hormones. from testosterone to estrogen. So you need vitamin D, you need magnesium, you need zinc. And then plus some of these antioxidants can maybe, help decrease some of this inflammation. Of course, not all of them, you know, could be technically safe because we don't know. So it's always better to check with your physician to see if it's okay taking some of these anti-inflammatory medications and anti-inflammatory supplements. Especially if you're breastfeeding, you have to be careful which ones to use. Some of them are safe, but some of them we don't know. Probably safe, but we don't know. So at the end, it's a decision of you and the physician, and depending on the symptoms, to see if you want to add those extra supplements. But in general, iron, vitamin D, thyroid, are extremely important. You can, like we talked, check your adrenal function to see how the adrenal function is doing, and then just talk and listen to the patient. I think is key.
Yeah, we see so many people on the fertility journey with that low, like all these things we're saying here. You got that the outset is the postpartum depression, but we see low vitamin D where people are it's in the teens or in the single digits, and then they're supplementing. But why is it low to begin with? And this is huge for for your reproductive health. Same with
it could
low.
be a problem with the absorption of the vitamin D and also from conversion, because you need the active form of vitamin D. So a lot of people might have issues converting the vitamin D or absorbing them. So knowing which issue we have is also important. But yeah, I think the same issues that you deal with before or to get them to get pregnant can still show up in the pregnancy, because the pregnancy depletes again all these vitamins from the body. So yeah, I think looking at their history and pre-pregnancy is very important in managing them postpartum.
Yeah, we've talked a bit about gut health. This is something that we do in our Fab Fertile method. We're doing stool testing. We see a lot of people with parasites, bacterial infections, fungal infections, H. pylori. So let's talk about gut health and postpartum health. What are you seeing there?
Yeah, I mean, like I said, the gut microbiome changes in the pregnancy, and in the postpartum period, it kind of returns into the pre-pregnancy form. But sometimes, depending how they delivered, whether a C-section or a vaginal delivery, the microbiome can change differently. It can affect their health and the health of their baby. Also, we know that. Unfortunately, we don't know like exactly how to fix the microbiome perfectly, and how each one of us which microbiome is optimal for that person. But we try to treat the dysbiosis in a way, but it's still not perfect science. But fixing the gut is important, because these bacteria react with food and nutrients, and then they're actually the source of our hormones and of our nervous system too. So, and a lot of the neurotransmitters. So definitely there's a gut brain correlation. So, and of course depression is something that we feel in our mind, in our brain, our emotions. So I'm sure the gut plays a role in that, but it's not a perfect science yet. But like you said, like we help them pre-pregnancy, working on the gut also postpartum could definitely help the depression and other symptoms.
Yeah, and there's also the vaginal microbiome and then the oral microbiome too. That's something maybe talk about the oral one, how that can impact pregnancy outcomes. I think many times people are like, oh, I got gingivitis and inflamed gums, or maybe I got a cavity or something like that. Well, that's like super important if you're on the pregnancy journey to look at your oral microbiome. I've done a couple episodes on that, but
that's one thing actually I used to ask before I got into functional medicine. On the first prenatal visit or before pregnancy, I would make sure they had the full checkup, and ask them about their oral cavity, any cavities, any gingivitis, odontitis. This is very important because there was at one point studies showing that there was a correlation with preterm labor. And then, bigger studies and meta-analysis showed that no, maybe it's not as, strong of an evidence. And then the things got dropped off. That it's not that important. But I still ask my patients about it. It makes sense. I mean, this bacteria in our mouth definitely gets into our bloodstream. When we brush our teeth, you get a certain bacteremia. So definitely it can play a role. We know there might be correlation with heart disease. So why not affecting pregnancy and preterm labor, preeclampsia? So yeah, I definitely always ask them about their teeth, make sure they have, recent cleaning, make sure they corrected any gingivitis. And then, of course, we always talk about the fillings, and some of these fillings contain mercury that can seep into our body. But I think most people now have, or most dentists stopped using, the old mercury fillings. But some people still have them for years, and every time they eat and grind their teeth, they're releasing some of this mercury. So yeah, the oral health hygiene is extremely, extremely important. Yeah.
And same with the vaginal microbiome. This is one of the tests we do too. We see a lot of people with recurrent miscarriage, anyone on the fertility journey, UTIs, bacterial vaginosis, infections in there, and we're trying to get pregnant. And then on the other side of things, with the postpartum period, with the vaginal microbiome, anything you're seeing there?
Yeah, I mean, of course, when after you have your baby, depending how you delivered, your vaginal microbiome can change. You might get recurrent infections that are, very bothersome, especially when you are trying to concentrate on breastfeeding and taking care of your baby. So the changes in the microbiome, vaginal microbiome, definitely is annoying and can cause symptoms. The relation like to postpartum depression or to, I'm not sure it's there yet for the vaginal microbiome, but I think it's more of symptomatology and at this point. But you never know what we might find in the future, whether there's a real correlation between vaginal. But I think the gut, because the gut is such a big organ compared to the oral cavity or the vaginal canal, then it plays a bigger role. But yeah, definitely the vaginal microbiome changes after delivery. So I'm not sure if it plays a role in the complications, but it's always important to have normal vaginal microbiome for the general health of the patient.
Mm-hmm, mm-hmm. And then from a lifestyle standpoint, I think we all know like the exercise and stress reduction and sleep. Obviously, with a new baby, that can be. I've done some episodes on how to
Yes.
help with that. Anything you'd like to say there from a lifestyle standpoint and stress and peace?
Yeah, definitely. Like talking about exercise, of course, every individual, every pregnancy is different. But most people, if they had a normal delivery, even with a episiotomy or a laceration, we try not to do episiotomies. But let's say they ended up with an episiotomy, or let's say they can, in a week or two, resume some exercise. Some people, exercise after a few days of a vaginal delivery. For a C-section, we like to wait a little bit longer before doing, strenuous exercise, at least, wait 6 to 12 weeks for the incision to heal. But you can start very light, low impact walking, even days after a C-section. So you don't have to, be in bed and not move and have issues with your scar. But so you can start gradually, exercising. Definitely it helps. I think the problem is finding time. So that's where I think the support system comes in, as the partner to help, for the patient to go take care of herself, walk around maybe for 20 minutes. It doesn't have to be hours, because exercise will definitely improve, your VO2 max, will improve the inflammation in your body, and then combining it with better sleep. Of course, sleep also is not a great, option sometimes after delivery, but try to sleep when the baby sleeps, and then take turns. If you have, you can try to sleep stretches of 4 to 6 hours instead of just waking up every 2 hours if you start pumping and somebody gives the milk to the baby. So there are ways around it, but it all depends on your home situation and on how things happen. But yeah, definitely sleep, exercise are key, and it's one area that you have to put effort in, and you have to support also the patient and try to give them as many resources as possible, um, to to sleep. Because if you don't sleep well, you're not going to recover well, you're not going to get rid of toxins, your inflammation will be high, your immune system will drop. So all these things can affect your healing process. So it's important to try to get sleep at least 6 to 7 hours a night, even if they're interrupted. I know interrupted is not great, but it's better than not sleeping the whole night. Night after night, it's gonna get. I compare like the postpartum fatigue. If you compare it to the actual fatigue that we have, let's say when we go to the gym or we had a long day, this fatigue lasts few hours and that's it, you're done. Whereas the postpartum fatigue, which is a real diagnosis, postpartum fatigue, this is like as if you're running a marathon every day. So you have no recovery. So you have to stop at some point and, recover and rest your body. Otherwise, you will collapse.
It's interesting. In Canada, we get a year off for mat leave. I think now it's almost changed to 2 years. And in the States, I think it's still I don't know if it's still at 6 weeks or maybe 3 months.
Yeah,
it's just it's insane. And then you're rushing. I remember trying to even get out the house before noon, and I'm like. Yes. I'm like a let's get it done kind of person. I'm like couldn't get out the house before noon.
Yeah, maternity leaves are so like diverse all over the world.
They are, right.
I think this has to be unified. This has to be, somebody has to change those rules in certain countries. It's not humane to go back to work after 6 weeks and you're breastfeeding and you recover by 6 weeks. I mean, this is where, everything goes back physiologically, but, what could have happened all this time? And so 6 weeks is never enough to go back and work. Yes, some people, of course, they tell you, I recovered. And the problem is, I think, social media also, because, these women will look at celebrities that recovered from a C-section in 48 hours and they're out there wearing dresses. And so, but that's not the reality. Mm-hmm. And when they see this on social media or they hear their friend or their neighbor, I recovered in 2 days, then it's going to be even more pressure and more depression and more, so that's the other problem. But yeah, maternity leaves are very important. Paternity leaves are also important, because you need both. So yeah, rules have to change in certain countries. I think in Canada, this is great. I mean, and this is something that will, I think, reflect later on the society and on the workforce much better than when you have to go back to work in 6 weeks or 3 months.
Mm-hmm. And let's just talk a little bit about the toxin exposure, like we were talking about beginning there. So obviously we were exposed to, our personal care, where like 85,000 chemicals we're exposed to, plastics, we were talking about fragrance. What are some things to help detox that and to really, we can minimize our exposure as much as possible, but what are some things to help with that?
Yeah. I mean, I think minimizing the exposure is the key. Mm-hmm. I mean, no matter how much you detox, although like I don't like the detox that, it's out there, which is, of course, a huge market that's not really regulated. But yeah, if we decrease the exposure, our body will get rid of a lot of these toxins. Yeah, some of them are more persistent. They take longer to get out of our bodies. But I think key is prevention and avoiding those toxins. But yes, we can also support the body, in detoxing, especially, for example, the liver, the kidneys. There are, few supplements that can be taken after delivery that are safe, like ALA, for example, is one of them. NAD, glutathione, these are not very well studied in pregnancy, so you have to be careful doing those, especially if you're breastfeeding. So yeah, I mean, supporting the liver and the kidney and eliminating these toxins, because there's 2 phases of detox. There's phase 1 and phase 2, so you have to really give good vitamins in order to make all these toxins soluble, and then you will eliminate them through phase 2. So you have to really support both phases of your liver detoxification. But again, if you are getting rid of your toxins and you're still getting some more from the other side, there's no point, I think. So the key is to avoid, especially women. I mean, women are more exposed to chemicals than men, from their creams, makeups, night serums, and many things. So one of the major culprits is, the bathroom, I think, is where, you have your products mostly. So look at your products, see which ones are good, which ones are bad. There are applications you can use that will scan your products, that will tell you which one are tough. Get rid of those. Maybe don't get rid of them all if you've paid a lot of money on those, but just use them less. So again, you don't have to have money and be rich to be able to live a toxin-free life. You can, you don't have to buy organic if it's more expensive, which is, the case in most countries. But clean well your vegetables, clean well your fruits, so that you can avoid all these pesticides from your food. And like I said, look at your products, try to use them as minimal as possible. Get rid of them if you can. Get rid of any plastic that you have at home. Don't put hot food in plastics. So there are, a bunch of things that you can do. Alternative products are out there. There's a whole list. And actually, myself and another physician here, we created an online course. It's going to be out, hopefully, next week. The landing page is already there and the coming soon page is there, but I can share it with you. But and maybe in a week or so, people can go in. It's a very cheap course that you can take. You learn, about how to get rid of toxins from the bedroom, bathroom, kitchen, car, restaurant, workplace, and we give you all the alternative products. But there are many of them out there, and then more are coming. So yeah, and you don't have to be rich to take the course, or rich to change these things in your life. You can do very tiny changes. Change your shampoo and your deodorant and your toothpaste, and you will see a difference in a few months. So you have to be patient, and support your body to get rid of the toxins and avoid them to start with. So this same thing applies to pregnant, postpartum, or men, women, children, like anybody. So it doesn't have to be only. But I think in the postpartum, if you do it, of course, in the pregnancy, it's super important. But if you do this also in the postpartum phase or after the surgery, then you will recover better. Your body won't be busy taking care of toxins, will be, taking care of the healing process.
And all these fragrances that we're exposed to now. When I smell, my daughter accidentally got a sort of a fragrance laundry detergent. I'm like, wow, that's just, I literally, that is so
detergents.
strong.
These are big because we wash our clothes, and we're wearing them the whole day.
Yeah.
So
it's interesting when you move away from it. It took me years to be able to change all this stuff over, and now when I smell that, so I can smell you can smell their bounce sheets on them. You can smell. It's interesting. You just have a heightened sense of smell now to be able to I don't think so.
Yeah, I mean, maybe that's one way. Just why women get aversions to smell when they're pregnant, because I think they are trying to protect their baby from these fragrances that probably are toxins. So that's maybe one way God created us to, as a defense mechanism. So yeah, I mean, I used to spray my whole self with cologne, so now no, if I may put more on my clothes than on my skin, to decrease some of this exposure. But yeah, tiny steps. You don't have to change everything overnight, but tiny steps will definitely help.
Exactly. Okay. And so your book here, Reframing the Fourth Trimester, Guide to Postpartum Wellness. So we'll have a link there. So maybe just kind of share where they can find it, and I think your website too.
Yes, currently, the book is on Amazon worldwide, so it can be purchased from there as an ebook, as a paper book, or as a hardcover. And my website is drlabibg.com. For any, advice or, information about optimizing pre-pregnancy, the pregnancy itself, and then the postpartum recovery, which is my new baby now. It's postpartum. So yeah.
Definitely check out the book. It's really good. It's a good foundational book to really get you started. So awesome. Well, any final thoughts for us today, Dr. Labib?
No, I think, first of all, I would like to congratulate you on what you're doing. I think, what you've done so far, and, helping people, especially after what you went through is so important. Anybody that has a story, I think, and, found a solution to share it with people. I think this helps a lot, spread awareness. A lot of things we say now might be different in few years. I don't know. Things are evolving. The field is evolving. So yeah. I mean, and the other important thing I want to say is let's normalize the postpartum phase and talk about it. Don't hide your symptoms. Seek help. Um, you know, it's a phase that was kind of enigmatic, and nobody, you deliver and you go home and you close your doors and nobody talks to you during that phase. On the contrary, I think, we should talk about it and help people, because it can affect the woman's health throughout her life. I mean, she can get traumatized or get, long-term chronic diseases just by not recovering well from a pregnancy. And especially if she gets into another pregnancy later, and then she's already in a non-optimized health, it's gonna get and deteriorate and get worse with time. So that's my message, is just talk about the postpartum phase, and seek help. And I hope my book helps. It's not, of course, it doesn't cover everything. It's just maybe an eye opener to certain things, and people can dig more into the specific issues they have with their healthcare providers.
Awesome. Great. Thank you very much for all the work that you're doing.
Thank you for having me.